Hi, so this is my video about my clinic, my private practice clinic that I would run if I was given $300,000. So my private practice clinic would be called Skywalker Physical Therapy, assuming that Skywalker isn't copyrighted or something along those lines. We'll go with Skywalker Physical Therapy. And the focus of my clinic would be it would be geared toward outpatient and orthopedic type patients, but primarily our specialty would be more along the lines of catering to uh, amputees and users of prosthetic devices. The biggest reason why I think this would be beneficial is because I think that's a very underserved population and frankly misunderstood and poorly understood population. As I was doing my clinicals, I kind of saw that, and there wasn't a whole lot of physical therapy options for them. And so I think it would be important for us to have a program in place to, first of all, when someone is considering or preparing to get an amputation or have a limb amputated, is to do kind of pre-training with them to try to teach them how to activate the muscles that they will be using with their prosthesis, and just kind of uh, get them in line with a social group as well, because it can be a very traumatic experience for someone to lose a limb. And so I think it'll be important to have that system in place to work with those amputees. And then afterwards, um, being that we will specialize in amputations and prosthetics, it'd be easier to deal with the mechanics of those and more closely understand them. One of the main things that I would want to feature in my clinic would be to have a walking track that has some sort of safety system, such as an overhead harness system, to allow my patients to walk and to be able to walk and use and practice with their practice with their prosthesis without fear of falling, because I think that's one of the biggest barriers that can happen with a lot of people. And so that would definitely be kind of the cornerstone and kind of a big draw in, is that we have such a tool at our disposal. As far as revenue generating services, I think with that walking system and with that walking harness, we can use that to have walking programs in place for our patients, and not so much when they're in an active treatment episode, but after they're done with their initial treatment and done with their initial training, just offering that as almost like a gym of sorts, to allow them to pay a certain fee, whatever that may be, for the month or what have you. And then for them to come in and just be able to walk in that space and feel safe while they're doing it. And, if we're around, giving them tips and heads up, and just having someone there with them but not actively treating them, just so that they feel safe and feel confident in what they're doing, and it gives them more practice in a safe, controlled environment. So that would be one of the ways that I would generate revenue. I mean, outside of the obvious of treating patients. The other way that I think would be uh, beneficial potentially is doing kind of fundraisers of sorts. And the fundraisers would be geared towards raising awareness of the the problems associated with the amputee community and things that we can do to help them. And so the way it would be set up, I think, is that we would run the fundraiser, and our clinic would take a small portion of the proceeds of that and just keep that as revenue, and then a large majority of that would go towards a charity of some sort that is involved with the treatment, or to the benefit of prosthetics and amputees, or will be dedicated to like research or something to improve the technology behind that, and just try to make the world of the amputees a little bit better for them, because that is a very big life change to go through, and it can be very hard for many people who do that. Um, so yeah, so that's my clinic. I hope that even though some of that may be just kind of off the top of my head, I hope that I am able to work with amputees as I go forward into my practice. And yeah, thank you.